Getting ready for gastric bypass surgery and its effects. As the obesity epidemic continues to grow, more and more people will turn to drastic measures to try to lose weight. There was a fad a few years ago where people would have their jaws wired shut. Another choice is to have gastric bypass surgery, which is a very serious decision that should never be made lightly. Anyone who is thinking that they are ready for gastric bypass of any type should stop and discuss all of their options with their surgeon, including the realistic expectations for what will happen after the surgery is completed. Patients who are not ready for the surgery can find themselves overwhelmed with what is happening afterward. Different gastric bypass surgery types. Gastric bypass surgery is not just one procedure but a blanket term for many different types of surgery. The most common of these types of surgery is the Roux-en-Y procedure, which makes a small pouch at the top of the stomach by using either staples or a plastic band. This procedure is not reversible. The lap band surgery is an adjustable gastric band which is placed around the top of the stomach. As the patient loses weight, the band can be adjusted to make it tighter and control hunger better. Without being adjusted, the band can slip off the stomach and cause serious problems. After the lap band surgery, patients will return to the doctor's office for adjustments several times, keeping them more accountable in their weight loss efforts. A sleeve gastrectomy is used in the most severe cases of obesity, those that are deemed to be too dangerous for the other surgical types. Another non-reversible procedure, this one is accomplished by removing about 15% of the stomach itself, stapling what is left into a pouch that will form a sleeve, giving the procedure its name. The procedure is usually done laparoscopically. This procedure may be done to kick off weight loss, after which the surgeon may convert to another type of weight loss surgery. However, if weight loss is progressing correctly, it may not need to be done. Gastric bypass surgery of all types can be done either as a laparoscopic procedure which offers fewer risks and shorter recovery time, or an open procedure which may lengthen the recovery time and increase the risk but may be the only option if complications occur. The surgeon may plan to use the closed procedure and then have to change once the surgery begins, which should also be planned for when taking time off work or making arrangements for help around your home until you are back on your feet. The guidelines for gastric bypass surgery. There are a number of guidelines for the gastric bypass surgery that must be met before it will be performed. For instance, the patient's BMI has to be 40 or above unless there are serious, life-threatening conditions that can be directly related to the excess weight. These chronic conditions can include cardiovascular disease, diabetes, and some cancers. The age guidelines are set at 18 to 65. However, some surgeons will consider performing the surgery on those who are younger if their life is threatened by their weight. You must have been obese for 5 years or longer and be able to establish that conventional diet plans are simply not effective for you. The doctor will also evaluate mental health. You cannot have untreated depression or major psychiatric disorder. You also cannot have an ongoing alcohol problem. Although the surgery is covered by insurance, your insurance company may have additional guidelines and restrictions that you may have to meet. Why education is the most important factor in gastric bypass surgery. If you do not know all the aspects of gastric bypass surgery, your first step should be to get all the information available. You need to know the types of the surgery and the way they are all accomplished. You also need to know how long the recovery time will be and the cost of the surgery. Insurance does cover gastric bypass surgery in most cases, because it is not technically an elective surgery type but rather a necessary one. Following up with all of your aftercare instructions is very important. If you don't eat correctly after your surgery, you may make yourself dangerously ill. For the first few weeks you can only eat liquids while the stomach heals. You will then progress to soft foods and finally to very small amounts of regular foods. Even when you get to the regular foods, you will be eating only 2 ounces or so at a time. If you try to eat more than 2 ounces, you can pop a staple or stretch the stomach pouch. You will also have to be very careful what you eat. If you eat a lot of simple sugars like candy, condiments, soda, and ice cream, you are also at higher risk for a condition called dumping syndrome, where the food moves very rapidly through your system and can cause shaking, sweating, dizziness, rapid heartbeat, and severe diarrhea. Nutritional needs after gastric bypass surgery. Because you can only eat small amounts of food each time, you have to be aware that nutrition becomes even more important. You will definitely need vitamins and other nutrients supplemented so that you are assured of getting the right amounts of each. The supplements that you are using must comply with the guidelines that you are given by your doctor, including the right size and without any unnecessary or potentially harmful ingredients. For instance, ProfectR, a small protein supplement from Protica, has 25 grams of protein, 100 calories, and no added carbohydrates or fats. Each serving is less than 3 fluid ounces in size and comes in a number of fruit-based and refreshing flavors. Exercise needs after gastric bypass surgery. If you are not a fan of exercise before your surgery, you will have to learn to like it afterward. While you are going to lose weight because of the severe limitation of calories that you are taking in, you will need to exercise so that you tighten your muscles. In addition, the exercise will also be helpful in keeping your metabolism and spirits high. Light exercise should be used during the initial recovery period, while more strenuous exercise can be introduced once the doctor okays it for you. Light exercise includes walking, yoga, stretching, or swimming.